Hello, I'm Dr. John Dorris. I'm an orthopedic surgeon at Athens Orthopedic Clinic. I specialize in shoulder, hip, and knee surgery. I do arthroscopy surgeries of the knee and shoulder, and I do joint replacement surgeries of the hip, knee, and shoulder. What makes our day is when we take a patient who's got somewhat of a disability from their hip, knee, or shoulder problem, and after seeing us and letting us help them diagnose and treat their problem, that they're back to their previous level of activity and happy with the result of the surgery they received. We're excited about advancements in technology, most notably with surgeries. The Mako robot is offering a higher level of precision and doing knee replacement surgery. We're also constantly seeing improvements in the materials that we use and implant in patients' hips, knees, and shoulders, improved materials with longer durability. And then we have new techniques in pain management that help the patient during the course of the recovery. So we have the term silent sufferer. Patients frequently will have a problem with their knee or hip or shoulder, and they have lived with it for 2 or 3 years and are intimidated to consider surgical intervention. And frequently that patient, 3 to 6 months after having the surgery, is delighted that they no longer have to tolerate the pain.